So nurses are uniquely equipped to really bridge that gap between policymakers as well as patients when it comes to environmental and climate issues.
We are highly trusted. I wanted to be a nurse because I aspired to be someone that could be trusting, that could help bridge between something very complicated when it comes to health to simple steps and simple instructions, and then be able to translate back and forth what the patient needs are to what the health needs are.
Year after year, we rate as the number one trusted profession by the public.
That speaks volumes about the potential for advocacy among nurses.
We really have a firsthand look at how policies really impact human health. And maybe we also have a foreseeable look of how future policies could impact human health.
I got into nursing because I wanted to be an advocate for patients and families, and I wanted to be able to be that person to be able to explain to patients and families the pros and cons of interventions, distill some of the jargon around medical terms.
Naturally, nurses are educators by training. We are caregivers by training. We listen and advocate for our patients on a daily basis.
As nurses, we see the human side of the story, and we make connections that others might overlook.
Nurses are very good at communicating in a way that builds trust with the families and communities that they serve, and using their assessment skills to understand what the needs are of a community.
But what nurses can do is really show legislators the human health side of why it's important to phase out fossil fuels.
But when it comes to policy and legislation, we take those same advocacy skills for our patients to our local legislators, both on a local or regional level and up to a national level, to ensure our patients have access to quality information and quality care, including environmental health care, to ensure that they have the best health care outcomes.
Legislators work for us, as I think we all know. And once we identify ourselves as a nurse, our legislators tend to open up to us. They tend to lean on us to understand that healthcare experience. I have seen what happens when funding specifically on climate change gets cut or gets removed completely. And so I was able to share that really with the legislators that say, when we don't have robust funding, this is what happens.
Climate can't wait. We need President Biden to act on climate now.
The Solutions for Pollution campaign will call on the Biden administration
to protect public health and promote environmental justice by strengthening federal environmental laws.
The passage of the Inflation Reduction Act was a tremendous win for climate, health equity, and our nation's job sector. But there's more that can be done to protect communities.
The Solutions for Pollution campaign will call upon the Biden administration to carry out its responsibilities under existing environmental laws, such as the Clean Air Act.
Advancing 20 key protections under federal agencies like EPA could cut climate pollution in half by 2030.
Strengthening protective standards under President Biden's administrative agencies will protect public health and drastically reduce climate warming emissions.